Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin today, I have 2 points I want to clarify. First, we have received questions from some Albertans who received their COVID-19 vaccine outside of the province and are wondering how they can update their online health records to reflect their recent immunization. No matter where you receive your vaccine, you should receive an immunization record that confirms which vaccine you were given and when. If you received a first dose elsewhere, bring that immunization record with you to your second dose appointment, and that first dose information will be entered into your health records. More information will be available soon about when second dose appointments can be booked for all Albertans, whether they received their first dose in or outside of the province. Second, I have heard a lot of questions at the new requirement for a medical exemption letter for those who have a clinical condition that makes them unable to wear a mask. Some of these questions have been about those who were unable to put on their mask or take it off by themselves. This remains a valid exemption in the order that does not need a medical letter. For other clinical conditions, it is important to know that people who have a condition on the list in the order do not automatically qualify for a masking exemption. Not all individuals with, for example, developmental disorders or anxiety experience difficulties when wearing a mask. Some do, which is why the conversation with that person's healthcare provider is so important. Wearing a mask consistently is an important way to protect ourselves and others, as we still have high case rates. Weighing the risks of not wearing a mask with any difficulties people might have when wearing one is an important part of the process and part of the reason for the new requirement. I hope this clarifies this question. Turning to today's numbers. Over the last 24 hours, we have identified 812 new cases of COVID-19 and completed about 9,000 tests. Our positivity rate was about 9.3%. There are now 665 people in hospital being treated for COVID-19, including 177 in the ICU. Sadly, 4 new deaths were reported to Alberta Health in the last 24 hours. I extend my sympathies to all who are experiencing loss at this time, whether from COVID-19 or any other cause. To make these losses less and less likely, vaccines are our best defense. The response from Albertans to get their COVID-19 vaccine has been incredibly encouraging. We have now administered more than 2.3 million doses of COVID-19 vaccine. With almost 51% of Albertans 12 and older now protected with at least 1 dose, we are making real progress. We know that vaccines save lives, and they significantly reduce the likelihood of infection. We also know there is good short-term protection in those who have received just 1 dose of a 2-dose series. I know that many people are looking for a plan outlining when we will ease restrictions as vaccine coverage increases in the population. Work is underway on this, and I expect more details will be released in the next week or so. However, recognizing the growing proportion of Albertans who are immunized, we are making a change to the quarantine period in Alberta that aligns with changes some other provinces have made, such as Ontario and Manitoba. While vaccines don't erase all possibility of infection, the data shows the vaccine reduces the amount of virus in the person's body, even if someone does get infected, which further reduces the risk of transmission. This is good news. Effective today, we are making 2 changes to our quarantine requirements. One for close contacts who are fully vaccinated with 2 doses of vaccine, and one for close contacts who have only 1 dose. Currently, Albertans are legally required to quarantine for 14 days when they are a close contact of a COVID-19 case. Beginning today, fully vaccinated individuals who have had their second dose of vaccine at least 2 weeks prior will no longer have to quarantine at all if they are exposed to a confirmed positive case. This is only as long as they have no symptoms at any point. To be clear, if a fully vaccinated individual is experiencing any symptoms, even minor ones, they will still be required to isolate and go for testing. If they then test negative, they would not be required to quarantine further. If they test positive, they must follow the protocol and isolate for 10 days from when their symptoms started. This is for any close contacts who have received both doses of a vaccine. For those who have received only one dose of a vaccine, these individuals will now have a shortened quarantine period if they are a close contact of a confirmed case. The quarantine period for these people with one dose of vaccine is being shortened from 14 days to 10 for close contacts who have no symptoms. In addition, if these individuals have a COVID-19 PCR test on day 7 or later of their quarantine period, they can be released from quarantine even earlier as soon as they get a negative test result. However, if they test positive, they will of course need to isolate as usual. If a partially vaccinated close contact is experiencing symptoms, then they would still be required to isolate as usual. More details are posted online to clarify these changes. I would like to note that this change does not apply to Albertans who are returning from international travel. International travels must continue to comply with the 14-day quarantine period required by the Federal Quarantine Act. This new quarantine approach within the province will mean less disruption for families, workplaces, and schools, while still preventing the spread of COVID-19. Most importantly, it only applies to those who have received the vaccine. For those who have not gotten any doses, there is no change to the 14-day quarantine period. Regardless of whether someone has had 1, 2, or no doses, all of the other restrictions in place still apply. I want to end today with a request to every Albertan. We are heading into the first long weekend of spring, and I know many people are excited to get out and enjoy it, especially after a cold and rainy week. However, our active case numbers and hospitalizations remain very high. We are gaining momentum, but it is fragile, and we cannot afford to take this weekend off from following the rules. That's why I am asking every Albertan to have fun and stay safe this weekend. Please follow the rules, avoid in-person interactions with people outside your household, especially indoors, and avoid non-essential travel wherever possible. The weather is warming up, the sun is shining, and summer is just around the corner. If we all stay vigilant and do our part just one more time, this might be the last long weekend when such sacrifices are necessary. So make this the safest May long weekend ever. Get vaccinated, stay safe, and please keep following the rules. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. We have a very full queue, but we will try and get through as many as possible. Operator, could you put through our first caller, please?
Kevin Nimick, CTV.
Hi, Dr. Hinshaw. Do you think a paid sick leave policy in Alberta would have saved lives during this pandemic?
It's certainly clear that when individuals are able to take time off work and not show up to work when sick, that is a helpful way of preventing spread. It's also really important to note that part of the policies that were introduced in December with respect to providing cost-free isolation and quarantine accommodations in hotels, as well as a payment that was prorated to the number of individuals in a household when it was the primary earner who needed to quarantine or isolate, that those policies do help to support individuals who are needing to make decisions on the basis of perhaps not a high income. So I think there are a suite of possible options, but it is certainly clear that as people are supported to be able to stay home when sick, as again, some of these policies have been put in place to do so, that this does help us to control spread.
Kevin, is there a follow-up question?
Yeah, Dr. Hinshaw, have you ever advocated to either the Premier or the Health Minister for the importance of a paid sick leave policy for Albertans?
I certainly have had discussions about the importance of ensuring people are able to take time off, but as I mentioned, the specific policy instruments to be able to do that, there are many ways of accomplishing that goal, and so again, the principle is important, and then the policy levers to accomplish that goal are diverse.
Operator, could you put through the next caller, please?
James Keller, Globe and Mail.
Hi, Dr. Hinshaw. I've got a question about vaccine hesitancy. We've seen through public opinion surveys the percentage of people who are either unwilling or unsure of getting the COVID vaccine dropped from like 45% in January to 17% today. It's quite the drop. Do you have any theories as to what is driving that change in public opinion, and what more do you have planned to increase people's willingness to get the vaccine even further?
I think in January, as we were just beginning our vaccine campaign, the fact that the vaccines we were using were relatively new technology, although of course the technology that supported these particular COVID-19 vaccines has been in trials and in development for decades. So there are years and years of research behind these to ensure safety. But I think that some people wanted to wait and see, and we've now had millions and millions of doses of these vaccines administered around the world with very close tracking of any kind of safety signals. And we've seen that the vaccines that we currently have available to us are safe and highly effective. And I think that as people have been able to see those around them receive vaccines and see the benefit and see the reduction of deaths that we've had over the past several months, see the reduction in hospitalizations in those age groups that are highly immunized, it's very clear that vaccines provide a great deal of benefit. And again, we've had the opportunity over the past many months to be able to show Albertans how seriously we're taking safety, to be transparent when we've identified anything that flags as a safety signal, as we have with the low chance of the vaccine-induced blood clotting, and to make sure that Albertans know that we're not taking any of this for granted and we're being transparent about our data.
James, is there a follow-up question?
Yeah, a follow-up actually on a different topic. I just wanted a quick question about the stampede. I know there's been a lot of focus on that lately. Just given the current COVID situation in Alberta, and with the stampede just 7 weeks away, what is the prospect of actually having an event like that, like a normal stampede, something with tens of thousands of people on the grounds at a single large event? Is that realistic, given the timeline here?
We've seen around the world, as countries have achieved high levels of vaccine protection, that they have been able to open up events, and even events that have larger gatherings, when that level of vaccine protection is in the population to prevent transmission and surges of particularly hospitalizations or ICU admissions. So again, I think with the supply that we anticipate coming over the next several weeks, and the excellent uptake and demand for vaccine that we've seen in Albertans who want to be able to get to a summer where we don't need these restrictions anymore and vaccines can take the place of the public health measures, we have that opportunity, and it really is up to all of us to reduce our numbers as much as possible right now. So we're starting with a low baseline to minimize that risk of hospitalization and ICU impact, and also to band together to reach the higher levels of immunization that can protect the community and enable those kinds of gatherings this summer.
Operator, could you put through the next caller, please?
Jason Herring, Post Media.
Hi there. There's been some concerns, particularly in Ontario, of AstraZeneca doses going unused and expiring. I'm wondering what our stock of AstraZeneca is and what our plans for it are, including second doses for folks who had AstraZeneca.
So we have approximately 7,000 doses of AstraZeneca vaccine available in the province. And it's my understanding that the expiry isn't until late June, so we do have some time. We know from the studies that have been done that the benefit of that second dose increases with a longer interval. And so having say a 12-week interval between the first and second dose provides the best chance of the maximum immune protection that can be longer lasting and provide a higher level of protection. And the individuals who started to receive AstraZeneca product in Alberta in early March would be reaching that 12-week point in early June. And so we do have a little bit of time to be able to watch and wait for the UK data on the impact of using different types of vaccine for first dose and boosters, so that we were able to offer Albertans who did have a first dose of AstraZeneca the most accurate and up-to-date information, so they're able to make decisions about which second dose they might wish to take, and ensure that the product that we have we can use for second doses at that recommended interval of 12 or more weeks to get the best overall immune protection.
Jason, is there a follow-up question?
Yeah, after hitting some record days for immunizations last week, it seems like Alberta's pace has slowed down a little in the last few days. We had about 27 shots reported each day from Monday to Wednesday, and then today we rebounded a bit with about 40,000. Wondering why we might be seeing a little bit of a slowdown in immunizations earlier this week.
As you may know, earlier this week, we just learned that Pfizer has done the research and validation necessary to be able to ensure that their vaccine can stay stable in a refrigerated environment for up to 30 days. And prior to that, when Pfizer vaccine came into the province, when it was distributed out to pharmacies, they would have to use it within 5 days of receipt. So there has been a little bit of unevenness as, again, this distribution across the province, when we get these shipments of Pfizer and there's a surge of administration in that 5-day window, and then sometimes that comes down as we wait for that next shipment. And so I anticipate over the coming weeks, as we are able to take advantage of that longer stability period, that we will have more opportunities to be able to even out and provide those high levels of doses going forward with a little less impact of the shipping schedules. And then again, that 5-day window that we previously had to use with all of our Pfizer vaccine.
Operator, could you put through the next caller, please?
Rick Bell, Calgary Sun.
Good afternoon, Doctor. The first question, and I will have a follow-up, is yesterday Premier Kenney spoke about working on that new reopening plan, and he also mentioned, in answer to a question, that about 4 to 6 weeks before we see, some substantial actually reopening of things that are closed now, like closed businesses. So in very general terms, what do you need to see to get us to a place where we could have a haircut, a gym open, a socially distanced meal in a restaurant, a coffee on a patio, and how does that fit in? We talked about a full stampede in 7 weeks. Why does it take 4 to 6 weeks to have a coffee with another person on a patio?
The timing of the exact changes is still being finalized. So again, some of those different examples that you mentioned, I would say that we don't necessarily have to wait 6 weeks for all of those things to happen. There may be some things that can happen sooner and other things that that we need to wait a little bit longer for. But what's really important to know is that when we've looked at examples from around the world of countries that have begun to reopen in a significant way, when those countries have done that too soon before they have a high enough level of protection in the population when it comes to vaccine, and when they still have a relatively high level of transmission and exposure risk in the population, they've experienced a rebound effect where they have another surge of cases that have gone into hospitals and ICUs. And so there are two things that we need. We need to increase our overall vaccination protection, which is currently well underway. And we need to be able to bring our numbers down so that when we are opening up again, we're doing so from a lower baseline with lower risk. And if we accomplish both of those things and stay the course again for just a little while longer, we should be able then to start opening some of those lower risk things a little sooner and being able to look to the summer as a time where we can have significant openings if we can achieve both of those things.
Rick, is there a follow-up question?
Yes, this is a real easy one. Yesterday, talked about school reopenings, and that's, of course, a very important move. To people who wanted to have some small amount of relief this weekend or in the next week, that is to say, who wanted to go with a friend to sit on a patio, socially distanced, in a little table with just the two of them on a sidewalk in a city, why would that be considered, or wanted to get a haircut from a real person who can do haircuts? Why would that be such a fatal thing to have happen in the next couple of weeks?
Right now, with the transmission rates that we have, with the exposure risk that we still have, although it is beginning to come down, which is encouraging, it's still high enough that if we open too soon and see that resurgence, which continues to then put people into hospital and ICU, it could delay the more significant openings that we think we'll be able to have in a few more weeks' time. It's important to note that we are still allowing, if you want to have an outdoor gathering with a friend and sit for coffee, just the two of you on in a backyard, that certainly is allowed with up to 5 people who are distanced. However, we saw when we had the ability for people to gather on patios, transmission not just between people who were sitting at the same table, but sometimes transmission between people in different households. And we saw, again, it's not the risk of those 2 people sitting on a single patio. It's that particular activity happening in every place across the entire province. And when we still have a high baseline exposure risk, that particular activity as people are gathering together, or the other example you used was personal services. Again, it's not a single barber shop that's going to tip the balance. It's every personal service across the province and the combined impact of those potential exposure risks. And if we can just hold on for a little while longer, we will be able to start that reopening. But right now, again, we get greater benefit if we hold on to these restrictions for just a little while longer, bring down those numbers. That will give us the best possible chance of having the summer that we want to have by starting at a lower baseline of cases and transmission.
Operator, could you put through the next caller, please?
Thank you. Carly Robinson, City News, Edmonton.
Hi, Dr. Hinshaw. I have 2 questions. I'm just going to put them back to back here for you to answer. Yesterday, AHS tweeted they're aware of someone claiming to book multiple vaccine appointments to try and waste dosage. I was just hoping to get your perspective on this. And the second part of the question, is there any update on movement towards a centralized booking system for pharmacies to take some of this pressure off and prevent this type of abuse of the system?
Thanks for the question. On the first, I had heard that report, that tweet had gone out. I'm not familiar with the specifics. Certainly, it's really important that anyone who is booking an appointment book at one place, ideally the earliest appointment they can get, and not take up appointments that other people are eagerly looking for. So that's a critical and important point. We are working very hard to have a centralized booking system in place. I don't have a specific date of when we anticipate that will go live, but there's been a great deal of work going on to make that possible, so that not only is that streamlining the appointments, so any of the examples such as the one you mentioned are not going to happen, but the other advantage is, of course, that Albertans sort of have a one-stop shop to be able to find the appointments nearest to them in a streamlined way. So that is coming on board, but again, I'm sorry, I don't have a specific timeline for that.
Operator, could you put through the next caller, please?
Thank you. Julia Wong, Global News.
Hi,
Dr. Hinshaw. Earlier this week, Albertans were just told that there wouldn't be different sets of rules for those who are vaccinated, unvaccinated. Now we're hearing about different rules for those who have 1 dose and 2 doses. So how come we're seeing that? And then how are you actually going to police that? Is it just going to be an honor system type of thing?
When we talked about being able to have different sets of rules for those who were or weren't vaccinated, often we were getting questions about can people who are fully vaccinated gather with others in a social setting, or can people who aren't vaccinated stop wearing masks? So those are the kinds of examples where we are not going to have individual policies that are different for some who are or some who aren't vaccinated, because those kinds of things, again, would require a kind of vaccine passport that would need to be shown to multiple different groups to verify that those individuals indeed were vaccinated. With respect to the quarantine, that's something that the healthcare system, which is a custodian of health information and able to access health information, and so the contact tracers and the case investigators who are already making these phone calls to make sure that people know that they were exposed to a case, they have, again, under the Health Information Act, the ability to collect and use that kind of personal health information. So that's why this is different from some of those other types of policies where any changes to those would need to be made based on overall population immunization level. And so when it comes to the follow-up of close contacts in terms of ensuring that people have actually received their doses, people will need to be able to share with that close contact, with the contact tracer, they'll need to share with the contact tracer the type of vaccine they had, the date that they got it, so that that contact tracer can verify the time period between the dose that they received and when the exposure happened, and verify that, again, they meet the criteria where they have to have received, again, whether it's the first or second dose, at least 14 days before the exposure happened for those doses to be considered protective. So there will be that verification that happens at that point of time when the contact tracer is having the conversation with the person who's been exposed.
Julia, is there a follow-up question?
Yes, on a slightly different topic about the May long weekend. What is your advice for Albertans about whether they should be traveling this long weekend? What activities are safe for people to do? And more importantly, how pivotal could this long weekend be to determining what we see with our third wave? So whether we see another surge or whether cases continue to decline.
So we know that Albertans are always keen to get out on the May long weekend as the first weekend of summer. What's really critical is that Albertans consider if they are able to do the activities they love as close to home as possible. That's the preferred option. If there's something, for example, like camping, it should be done only with people in the same household, so not camping with multiple people who don't live together, all then staying together for the weekend. That is absolutely problematic and potential for spread. And if people are, again, choosing to go camping or do some activity like that, making sure that they're preparing in advance, buying their groceries close to home in the places that they normally are, minimizing contact with others. And if we're able to do those kinds of things this weekend, it gives us the best possible chance at being able to hit those targets that we're working on finalizing in terms of reaching the lower case counts and the higher vaccination rate, to be able to have a wider opening so that when we get to the July long weekend, hopefully we will not be needing to have this kind of significant restriction on Albertans, and we can all enjoy the kinds of activities that we have been missing over the past year.
Operator, could you put through our final caller, please?
Julie Doublejack, CBC.
Hi, Dr. Hinshaw. My first question is, Callaway Park said earlier this week it has a public health order exemption to open this weekend, but they decided to instead open on June 5th. How can this exemption be given when we still can't gather more than 5 people outdoors?
I'm not aware of an exemption that's been provided to Callaway Park, so I can take that away and we can look into it, but I have not signed an exemption. So again, I think it's important that all Albertans are following the current rules, and again, that's not an exemption that I've granted.
Is there a follow-up question?
Yeah, I'm curious about pregnancy and second doses and hoping that you can clarify. Obviously, pregnancy is a limited time period, and I've had one person tell me they were able to receive their second dose 4 weeks after their first from a pharmacy prior to giving birth and was told that this was at the direction of AHS to do so. Is this accurate? Can pregnant women book a second dose 4 weeks after their first if it falls within their pregnancy?
I'm not aware why Alberta Health Services would be providing direction to pharmacies. And right now, in terms of that shortened dose interval, we are offering that second dose within the 4-week time period to those who have a profoundly immune compromising condition. Pregnancy isn't currently on that list, and I do know that there are many people who are keen to get that second dose as soon as possible. We are again weighing out the benefits and risks, because while an individual does get a boost of immunity from the second dose, there's recent evidence out of the UK that shows that when you have a longer interval between the first and second dose, the overall boost to immunity is much greater when there's that longer time period. Recognizing that that may not be relevant for somebody who is pregnant, again with that that short period of time during which that condition applies. It's also important to know that a person who receives the vaccine has that protection, and they also protect others around them. So the more that we're able to use our current supply of vaccine to broaden protection in the population, that does protect individuals, for example, who are pregnant, who have an immune compromising condition, or have some other condition that puts them at risk. And so there's, again, a balance of different benefits here, but we are really focused on providing that first dose protection to as many people as possible, and anticipate we will be able to start offering second doses at some point in June as we have sufficient supply and we're able to move on to that opportunity. So I would just ask for those who are looking for that second dose to keep an eye open for when we're able to start offering it. And AHS and pharmacies will actually begin calling people who are eligible based on when they got their first dose as soon as that particular phase begins.
Julie, we will investigate the issue of the exemption and get back to you offline. Thank you all for joining us. Dr. Hinshaw will provide another update early next week. Have a safe long weekend.